Hello, good afternoon. I am somewhere in the wilderness of beautiful Scotland and just taking a walk in a forest um, somewhere in the north of Scotland. And I was thinking about um, one of my friend who's a solicitor. He was talking about he was actually talking to me about one of the posts I had put up on the LinkedIn about that every lawyer is a bit of a psychiatrist as well, and he was basically saying that how to quickly ascertain during the course of the interview with the client whether something is wrong with them and what kind of professional they should be referring their client to. And I said that you're already doing what is required to quickly assess someone's mental state the way we psychiatrists do, which we call a mental state examination, um, which is basically about observing the client, how do they look, what they're wearing, how they're sitting, what sort of eye contact they are making, what sort of things they're talking about. Are you able to follow their train of thoughts? Are they distracted? Um, do they come across as reliable, intelligent? Um, so today I'm not going to tell you anything new. I am going to give you a checklist though, which you can go through in your mind when you're speaking to your client so that you don't miss anything. So my gift to you today is this mnemonic, which is ABC stamp liquor. So A for appearance, so that is what your client is looking like, what sort of clothes they are wearing. Are they wearing a t-shirt and a short in the middle of December in Scotland? Or are they wearing a woolen hat in the middle of summer months in Pakistan? And the second thing is B, ABC. So B is for behavior. So what sort of things they are doing? Are they sitting comfortably on the chair, or are they
Don't know why it's a snap.
sorry, I'm a bit distracted
Isn't this way
with my boys and the dog, and they are as usual taking advantage of the freedom, which is good. So B for behavior. So what sort of things your client is doing, what sort of eye contact they're making, what sort of um, body movements they are displaying. Then C for cooperation. So are they cooperating with you, or are they aloof and non-cooperative? Stamp. So S for speech. So what sort of speech they're displaying? Um, what is the quality of their expressive and receptive speech? So in speech you basically think about the rate of the speech, how fast or how slow they're speaking, the rhythm of the speech. Um, so that is it interrupted, for example, and the volume of the speech, is it too high or is it too low? Um, Stamp, so T, um, T for thoughts. Are you able to follow their train of thoughts? Um, do they display a disjointed thinking pattern? Um, are they jumping from one topic to another? Um, are they too inclusive of details, not coming back to the point in discussion and just going here and there but not giving you the straight answers? Stamp, so A, affect, so what sort of facial expressions do they display? Is it sad? Is it sullen? Is it jovial? Um, is it ecstatic? So affect. And then mood. You ask them, how do you feel in your mood? What do they say? Do they say they feel sad? Do they say they feel, for example, on top of the world? And then you think, how does their mood look like to you? Um, so if they're saying that they feel sad, do they actually come across as sad to you or not? So the objectivity and the subjectivity in the assessment of the mood. P. So P is for perception. So are they displaying any distractibility? Are they responding to unseen stimuli? Are they listening to things that nobody could see? Are they seeing things that there's nothing about, but they are communicating with unseen stimuli? So then liquor, L for level of lethality of the previous self-harming incidents. You always ask them if they have. Sorry, excuse me. Can you guys keep moving, please? Keep moving. So the lethality of the previous suicidal attempts, which is always an indicator of risk in the future. I. So I is for insight. What sort of insight or understanding do they have about their own problems, about their own mental health problems or physical health problems or legal problems? So their own understanding about those sorts of issues. So liquor, C. So C is for cognition. So are they able to pay attention? Are they able to concentrate on the topic of discussion? So a very quick test which I use. I mean, there are numerous, but the one I use is to ask them to spell the word world in backward direction, which is always a good indicator and test for somebody's attention and concentration span. Their memory, what you have discussed with them, you have asked them, they're giving you an answer, and you check it again in 10 minutes time just to check what is the short-term memory like. Are they forgetful? Do they confabulate? So confabulation is something where you have got memory problems, but you fill the gaps by putting in unnecessary, irrelevant details. If you have met somebody who struggles with dementia, you would recognize what I'm talking about. And then K for knowledge. Do they come across knowledgeable? What is their education level, basically? That's what this is about. Where are we now? Yes, E. So E for ending. You always ask someone you suspect who has some sort of mental health problems about suicidal ideation. You ask them, how do you feel about the future? Do you have any bad thoughts do you have any thoughts of harming yourself or harming anybody else? Um, so you ask that question, which is very important. And I think there's one more to go. That's right. R. So R is for reliability. Do they come across as reliable to you? Or do you feel that they are telling you lies and being dishonest with you? So there you go. ABC stamp liquor. Good luck.